Okay, here we are at our start time. I want to welcome everybody to our Wildfire Smoke and Lung Health webinar. My name's Chris Lamb, and I'm the President and CEO at the BC Lung Foundation. And I'm so grateful for everyone who's joined us, both here live for this webinar, and also anybody who will be watching this in the future, as this will be posted on our website at bclung.ca. Of course, I want to also acknowledge that the BC Lung Foundation office is on the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh Nation, where we currently have the privilege to work, live, and play. And it's that very relationship with the land, which is what's bringing us here today to talk about wildfire and how that relationship really works with our lung health. Today, we're going to be moderated by Dr. Chris Carlsten, who is one of the foremost experts, one of the smartest people I know in lung health. He will be moderating this session, and we're going to hear a fantastic talk from Dr. Stephanie Cleland, who's really going to walk through this process with us. We're going to have a lot of time for questions and answers, which will be moderated by Dr. Carlsten. A little bit more about Dr. Carlsten. He is a professor of medicine, and he's the Canada Research Chair in Occupational and Environmental Lung Disease, and holds the AstraZeneca Chair in Occupational and Environmental Lung Disease at the University of British Columbia. He is the head of UBC's Respiratory Medicine, director of the Air Pollution Exposure Laboratory, as well as the Legacy for Airway Health, and holds adjunct positions at the Peter Wall Institute for Advanced Studies and the UBC School of Population and Public Health. Without further ado, I'm going to turn it over to Dr. Carlsten to get us started. Dr. Carlsten?
Thank you so much, Chris. Good morning, everyone. This really should highlight Dr. Cleland. I'll tell you a bit more about her and really all I'm learning in the last few years is how the next generation is much smarter, much more efficient, and obviously going to be leading us through this very challenging next decades regarding smoke and other environmental threats. So Dr. Cleland is someone who I've really enjoyed getting to know in the last few years, since I heard about her when she was still back in North Carolina. She's now thankfully an assistant professor in a role that's co-sponsored by the Legacy for Airway Health and Simon Fraser University. She is the Legacy for Airway Health Chair in Promotion of Lung Health, and splits her time between the Center for Lung Health just across the street from BC Lung and Simon Fraser University. As I said, she was in North Carolina, where she earned her PhD and master's at the University of North Carolina at Chapel Hill. And as you'll see from what she discusses and probably in the question and answers, she has a really nice intersection between environmental epidemiology, exposure assessments, and health impacts. And she's going to apply that today to discuss wildfire smoke and lung health, knowns, unknowns, and future directions. And we'll have time for questions at the end. Thank you so much. Stephanie, take it away.
Great, thank you for the introduction. Let me quickly share my screen and make sure everyone can see that.
It looks great.
Perfect. Okay, so thank you for the introduction. As Chris mentioned, I'm Stephanie Cleland, and I'm an assistant professor at Simon Fraser University, as well as at the Legacy for Airway Health. And today I'm going to be talking about wildfire smoke and lung health. And this is a really broad topic, and I want to emphasize that what I'm going to touch on is just scratching the surface of how important and complex this topic is. But hopefully I'm able to give you an overview of what we know, what we're learning, and specifically highlight some fantastic research I'm involved in BC about trying to push towards the future and what we still need to learn. So to provide some background about why we are talking about this is primarily because wildfires are increasing. This is globally, but also specifically across Canada. And these two plots here are kind of emphasizing how wildfires have increased over time in Canada. So 2023, as we all are likely familiar, was an absolutely record-breaking season in Canada. But looking at this plot here is showing over month to month the estimated area burned. And you can see that 2023, by August of last year, really blew these estimates of how much area burned out of the water. And I want to emphasize that this 2023 number is especially remarkable because these 2018, 2017, and 2021 seasons were also record-breaking, really bad seasons across Canada. So this is truly setting the scene of all of these bad years are very recent and it's increasing. And similarly, we can look at overall area burned for Canada. This is from a great paper recently published in 2024, looking at the cumulative area burned by different regions. And you can just see, you know, there's some year-to-year variability, but over time, the area burned by wildfires has increased. And climate change isn't the only thing fueling this, but climate change is really helping fuel these increases across Canada. So largely due to increasing temperatures, right? This plot here is showing this past winter, which we're all likely familiar was a pretty warm winter. And it's showing the temperature departures from a previous average. And you can see across Canada, it was a lot warmer than typical. And this is also leading to widespread drought conditions. So this is just in late August of this year, so just last month. And you can see that even in parts of BC, there's extreme and severe drought conditions across lots of the provinces and other provinces and territories. And these combination of factors, in addition to some other things, is leading to an increased risk of fire. So this plot here is showing the fire weather index, and this is in July of this summer. And you can see that there's a very high fire weather index, which means it's good conditions for fires to start and spread. So climate change is playing a role in increasing these fires. And what we're really talking about today is what these fires emit, right? So I'm not specifically focusing on fires, but I'm going to be focusing on wildfire smoke. And wildfires emit enormous amounts of smoke. So this plot to the left is showing the carbon emissions from the 2023 fires, right? So we can see the previous years between 2000 to 2022, and then you can see the carbon emissions from 2023. And there's an insane amount of carbon emissions. In fact, there's a recent study that was released that showed that the Canadian wildfires were one of the top carbon emitters in 2023. And this is just after India, China, and the US as countries of carbon emitters. So it was one of the largest carbon emitters in the world last year by the amount of emissions. And one of the key things about wildfire smoke, and one of the reasons we study the population health impacts of wildfire smoke, is wildfire smoke doesn't just impact the people living near the wildfires, but it impacts large communities both near and far. So this diagram to the right is showing wildfire smoke from 2023 last summer. And as you can see, you can have the smoke from the fires that are happening here in Canada, and you see this long range transport, right? These red areas where that heavy smoke is, and it's coming down to the eastern US, and some of it's even reaching all the way over to Europe. So we have both those impacts locally near the fires, but that smoke spreads across large regions and impacts a lot of communities both near and far. And notably, smoke significantly worsens the air quality. This picture to the left is from New York City of last summer. And this is something that, you know, us in British Columbia and in Canada are probably getting more familiar with, right? Those orange skies, that hazy sky, you go outside, your throat burns, your nose stings, your eyes water, right? It's this sensation where it really changes the air quality in a very visible way. And this can lead to lots of air quality alerts or air quality statements. So these news articles are from, these two to the left are from this summer, and it's talking about how smoke from Canada wildfires were issuing air quality alerts in the Midwest US, how air quality statements in Ontario were being issued due to wildfire smoke or wildfires in the prairies. And then from last summer, alerts showing that air quality in Toronto was among the worst in the world. So it really significantly worsens the air quality in a very notable way. And in terms of thinking about how bad the air quality is, right, we have these air quality guidelines that are set both, you know, nationally and internationally to try and protect health. So the WHO air quality guideline is something that's set. And in 2023, if you look at this plot to the right, plot B, right, most of Canada experienced over 40 days where the air quality was worse than that air quality guideline. And that's really notable because that's an extended period of time in which people are breathing in air that has been flagged as notably bad for your health. And it's not just 2023 that was particularly bad, it's been worsening year over year. So 2023 was extreme, but it's not like it's this, you know, extreme anomaly that smoke is getting worse. In fact, there's been research that shows that Canadians' exposure to wildfire smoke has increased by 220% over the last 2 decades. So we're seeing this general increase in trend in people's exposure to wildfire smoke. And notably, British Columbia is one of the more impacted areas of Canada. So it's not all of Canada equally experienced to smoke, and BC has a long history of very severe wildfires and wildfire smoke impacts. So this map is something I've been working on this past year, looking at the frequency of wildfire smoke events across the province. And you can see here between 2010 to 2022, if you look across communities in British Columbia, right, we really get the interior British Columbia and northern British Columbia as these areas that experience a ton of days impacted by wildfire smoke. And as I mentioned, this isn't something that is distributed equally year to year. It's something that's been increasing over time. So this plot here is showing the number of days in these communities. So the distribution of number of wildfire smoke days across these communities in British Columbia. And you can see that this distribution is shifting right over time, right? If you look at 2022, that has much more focused at, about 40 days in each community compared to looking at 2010 to 2011, which was much lower, around, 5 to 10 days per year. So it's really increasing and we're really impacted. And these two news articles are from this summer alone and highlighting that while 2024 wasn't as record-breaking as 2023, it still led to a lot of severe smoke impacts, right? So we had lots of smoky days in central and northern BC, and there's air quality statements across lots of BC due to wildfires, both in the province and in Alberta and other areas. So I've been talking a lot about wildfire smoke, people's exposure to wildfire smoke, how it's increasing, but what is wildfire smoke, right? When we talk about the health impacts and then focusing on the lung health impacts, it's important to understand what is in wildfire smoke. So wildfire smoke is not just one air pollutant, it's actually this complex mixture of air pollutants, and it includes these very small particles, as well as other hazardous air pollutants, such as carbon monoxide, carbon dioxide, hydrocarbons. And within wildfire smoke, right, things are produced when the trees and other materials like houses are burnt, but also wildfire smoke, the mixture changes as it moves away from the fire because there's atmospheric reactions that happen that produce additional pollutants. But from a public health standpoint, when we're talking about wildfire smoke, the thing we tend to focus on is PM 2.5, which is particulate matter that's less than 2.5 microns in diameter. And if you look at this diagram here, it shows a human hair for scale. And these tiny pink ones, right, that's PM 2.5. And so within PM 2.5, right, there's these really, really microscopic things that are suspended in the air that are emitted when those houses and trees are burnt. And why do we care about those particles in smoke and other things about wildfire smoke? It's because when those teeny tiny particles are inhaled into your lungs, they can get to the deepest part of your lungs, and some of those particles, once they're in your system, can even enter your bloodstream. And once these particles are in the deepest part of your lungs, once they're in your bloodstream, this can trigger irritation and inflammation throughout the body, and this can lead to a lot of serious health effects, right? It can lead, trigger oxidative stress, it can trigger inflammation, and that causes a whole host of reactions in your body that leads to these adverse health effects. So in terms of how wildfire smoke affects our health, right, I'm going to be focusing on lung health today, but I wanted to quickly highlight that it's not just our lungs that are impacted by wildfire smoke, right? When we look at wildfire smoke, and particularly those teeny tiny particles that are contained within wildfire smoke, a lot of good research over the past few decades has shown that it can increase the risk of respiratory outcomes. It can impact our hearts, right? Increase the risk of adverse cardiovascular outcomes. It can also increase all-cause mortality, so just generally increases the risk of death. And there's also emerging research showing that if you're exposed during pregnancy, it can affect birth outcomes, such as low birth weight or preterm birth. There's emerging evidence showing how it impacts both our cognitive and our mental health, so affecting our ability to focus or pay attention, and affecting our general mental health and well-being. And there is also emerging research focusing on chronic diseases. So wildfire smoke can really, again, once it's in our system, it can really affect a whole lot of things. But per the name of the talk, today I'm going to be focusing specifically on the impact on our lungs and the respiratory effects of wildfire smoke exposure. So in terms of what we know about the respiratory effects, this is pulled from a large body of epidemiologic evidence, as well as evidence from human and animal and other studies that kind of bolster what we know about the biological mechanisms of these impacts. But pulling from that extensive epidemiologic evidence around wildfire smoke and respiratory effects, right? We know that when people are exposed to wildfire smoke, it can increase the risk of being hospitalized for respiratory conditions. It can also increase the risk of going to the emergency department, right? If you have an asthma exacerbation or a more severe reaction to wildfire smoke, it can increase the risk of ED visits. It also increased general physician visits, so maybe less severe than being hospitalized or going to the emergency department. But when people are exposed to smoke, more people go to the physician with respiratory-related complications. And it also shows that it increases medication use, right? So people tend to use more respiratory-related medication after they're exposed to wildfire smoke. And with that knowledge, this focuses, again, broadly on respiratory effects, but a lot of the research has focused on specific respiratory endpoints. So not just general hospitalizations or ED visits or medication use, but those specific respiratory outcomes for conditions like COPD. So COPD exacerbations or asthma medication use, right? Are people using more inhalers when they're exposed to wildfire smoke? There's also research showing that people have more physician visits or hospitalizations for respiratory infections, right? So we focus on specific endpoints within respiratory health using these broader data points about hospitalizations, physician visits, and medication use. And this provides us a pretty good understanding of the many ways in which wildfire smoke can affect our lungs. But one of the key things about the research to date is that it's all focused on short-term. And this is both short-term exposure and acute outcomes, so short-term health effects, right? So historically, we've treated wildfire smoke as this acute exposure, right? Wildfire smoke blows in, it stays for a couple of days, people are exposed to extremely high concentrations, and then usually the plumes move on and the smoke clears out. And because of that, a lot of this work has focused on looking at exposure at the daily and weekly level. So when someone's exposed to one day of wildfire smoke, that increases the risk of going to the hospital the day after or the same day, right? So that's kind of how we've treated it in the epidemiologic literature, is looking at those kind of short-term exposures and those acute respiratory effects. And with that, we do have a very strong understanding that short-term exposure increases the risk of respiratory morbidity, looking at acute effects like medication use, ED visits, physician visits. And we also know, based on the available research, that wildfire smoke doesn't affect the lung health of populations equally, right? There's certain populations that face a greater risk when they're exposed to wildfire smoke. And this includes populations that have increased susceptibility. So this includes infants and children, right? Children and infants actually breathe in more particles per body weight or per size than adults do. So they have a higher effective dose of exposure. They're also often more outside. They have different nature of like when they're outside, how much they're breathing, their breathing rate. And this really increases their susceptibility when they're exposed to wildfire smoke. Similarly, older adults have an increased susceptibility, given that their general immune systems and other things are less robust as you age. So there's an increased susceptibility among people who are older. Additionally, we have increased susceptibility to wildfire smoke among people with chronic conditions. So if you have asthma, or if you have COPD, or if you have other chronic lung conditions or other chronic diseases, right, you're likely going to be more susceptible to the adverse health effects of wildfire smoke when you're exposed. And finally, we also know that pregnant people tend to be more susceptible to wildfire smoke, right? Because when they're pregnant, right, if someone is exposed in utero, right, that could increase the risk of different complications. But in addition to increased susceptibility, we also have at-risk populations that are at risk because they have elevated exposure. So they're not necessarily increased susceptibility because they're a child or because they have a chronic condition, but they're at higher risk because they are exposed more to wildfire smoke than other populations. And this includes people who live outdoors, so thinking about unhoused populations or people who just are outside a lot more, right? They're going to have increased exposure because they don't have an indoor environment in which to go reduce their exposure. Similarly, people who work outdoors, thinking of agricultural workers, thinking of wildland firefighters, right? There's occupational populations who are going to have higher exposure by nature of their work, right? If they work outside, they're likely going to be breathing more smoke. And also often a lot of occupational work in the outdoor environment is very physically demanding, which often means you're breathing heavier, right? And that, again, increases the amount of exposure that you have if you're breathing more heavily. And finally, people who have elevated exposure include those who lack access to clean indoor air. And this can cover a broad range of people, but thinking about people from, low-income families or people who may not be able to afford an air cleaner or afford a house that is well sealed or can really close and seal the doors and windows, right? If they go indoors, they may not actually be able to reduce their exposure because their indoor environment isn't clean. So when we think about at-risk populations, it's both thinking about the increased susceptibility, but also thinking about those who have elevated exposure for a variety of reasons. And critically, it's also important to think about the risk of wildfire smoke when we have these overlapping, right? When you're looking at people with chronic conditions who work outdoors, right? When you have those layering things, then you really do have an elevated risk among that population, right? If you have asthma and you also are an agricultural worker, that's going to put you at a really elevated risk of respiratory effects from wildfire smoke. I think another really key thing to highlight with wildfire smoke is the impact of different levels of concentrations. A lot of our focus when we think about wildfire smoke and talk about the respiratory effects of wildfire smoke focuses on those very high concentrations, right? So it focuses on when it's orange and hazy and, you can visibly see that smoke outside, you can smell it, you can feel it in your throat and your lungs, right? That's when we tend to really focus on wildfire smoke. And one of the useful tools we have for communicating the risk of wildfire smoke is something called the Air Quality Health Index, which is this table to the left here. And it basically categorizes the level, the risk basically posed by the air quality levels as low, moderate, high, or very high, depending on how much of that particulate matter from wildfire smoke is in the air. But one of the key things to understand is wildfire smoke poses a risk at lower concentrations than those very high levels. So it's not just those very high levels that pose a risk, it's also those low levels. So this figure to the right is something that my colleague, Dr. Sarah Henderson at the British Columbia Centre for Disease Control put together to kind of help communicate the risk of lower level concentrations of wildfire smoke. And this black curve here is showing the relative rate of asthma-related physician visits in British Columbia. And you can see that at lower concentrations, we kind of have this sharper increase in the rate of asthma-related physician visits. And then at high concentrations, that rate kind of levels out. So you don't get a sharp increase at a certain point. And by nature of how the effects of wildfire smoke PM on asthma-related physician visits, right, it follows that shaped curve. That means when we look at the burden, right, how much, of the asthma-related visits are attributable to wildfire smoke, it's not all in this very high level, right? Only 16% of the attributable asthma-related physician visits are due to very high. But actually, if you look at these low levels, 35% are due to those low levels, right? So we do see these effects at very low levels of wildfire smoke when you can't even maybe detect the smoke in the air, right? There could be smoke in the air, but it may not be as visible or you can't smell it as well. Those still pose a risk and can have an effect on our respiratory health at these lower concentrations. Similarly, because these low concentrations have these effects, not just at the extremely high, wildfire smoke can have really wide-reaching impacts. So this here is a health impact assessment that was conducted by some people at Health Canada, and it looked at 5 years of wildfire particulate matter exposure, right? 2013, 2014, 2015, 2017, and 2018. And by looking at the wildfire smoke exposure during those years and combining that with what we know about the risk that those pose to our health, and this is in general a 1 to 9% increase in risk of respiratory outcomes per 10 microgram or 10 unit increase in that particulate matter, right? That seems like a pretty small risk. And, this exposure isn't extreme over all of Canada, but when you combine that risk with that exposure, right, we can calculate that during that time period, there was 1.4 million acute respiratory symptom days due to wildfire smoke. And we can also look at the attributable respiratory emergency room visits. So 170 in 2013 alone, 420 or 710 in 2017 and 2018. And so even when there's a relatively, 1 or 2% increase in the risk per unit change in wildfire smoke, because those low levels pose a risk and because that smoke can travel really far distances across all of Canada, we can get this really large impact. So again, hundreds and hundreds of attributable respiratory emergency room visits or symptom days, right? And then you can attach that to the economic valuation, and that's, millions of dollars, right? So it has these really wide-reaching impacts when you think about combining that wildfire smoke exposure with the risk and actually looking at how many hospitalizations are due to this and what's the cost of that. So wildfire smoke has this really wide-reaching impact across communities. And I kind of now want to shift into looking and talking more about the emerging evidence. So I kind of touched on what we have a really good grasp on in terms of wildfire smoke and respiratory effects. But because wildfire smoke is becoming this more and more common exposure, one of the fantastic things that's happened is people have started studying more and more about how wildfire smoke affects our lung health. And this means we're learning more and more every year about the different ways it can impact us. And one of the emerging pieces of evidence that I think is really key to highlight is that that particulate matter that's in wildfire smoke may actually pose a greater risk to our respiratory health than other sources of PM. So particulate matter from traffic, particulate matter from industry or other sources, right, may actually be less harmful compared to the particulate matter that's in wildfire smoke. And this plot here is from one specific study looking at cardiopulmonary effects and looking across the United States. And the main thing I want to highlight here, there's kind of a lot going on in this figure, but this top figure is looking at hospitalizations for any respiratory outcome. And these non-filled in shapes, right, the white shapes are for PM 2.5 on days without smoke. And these filled in black shapes are for smoke, PM 2.5 on days with smoke. And you can see that in general, there's a higher risk of hospitalization for respiratory outcomes on days with smoke versus days without. And this is true also when you look at more specific outcomes like hospitalizations for asthma, bronchitis, or wheezing, right? You see this much elevated risk associated with wildfire PM exposure compared to PM from other sources. So that's really critical when we think about the respiratory effects of it, is if it is in fact more toxic to our health than other sources of PM, then it really is important to think about how we can reduce exposure and protect those most at risk. And it's, we are learning also why it might be more toxic to our health. And this is due to a few reasons, right? It can be due to the composition. So that particulate matter, the composition of it changes depending on the source. So depending on where it's coming from, the composition of that particulate matter is different. So the composition of the PM from wildfires may play a role in the toxicity, right? And then also with wildfire smoke, the way we're exposed to that is very different than the way we're exposed to other sources of particulate matter, right? With traffic pollution and factory pollution and industry pollution, right, we're kind of exposed to a consistent low level exposure over time. Versus with wildfire smoke, we're exposed to much higher levels over shorter periods. Right, so it's potentially due to that difference in composition and toxicity of the particulate matter based on what's burning and based on where that PM is coming from, but also depending on how we're actually exposed to that source. But the key thing here is that it may be more toxic to our health than other sources. Another important line of emerging evidence is the potential for synergistic effects, right? Our exposure to wildfire smoke and wildfire particulate matter doesn't exist in a vacuum, right? We're exposed to multiple environmental hazards at the same time. So it's not like you're just exposed to this thing or just exposed to this thing. And there's emerging evidence that when people are exposed to heat and wildfire smoke at the same time, this can amplify the adverse respiratory effects of wildfire smoke, right? And so this is highlighting the results from a specific paper that was focused on cardiorespiratory hospitalizations in California. And the main thing I want to point out here from this plot is, they're looking at different thresholds and different levels of smoke and heat. But the key thing to pull away here, right, is we have on the x-axis the effect of extreme heat alone. We have the effect of wildfire smoke alone, and we have the joint effect. And if you look here, it's very clear that the joint effect pops up as having a much higher risk for cardiorespiratory hospitalizations than either exposure alone. So it's really important to think about wildfire smoke, not just in the vacuum of, we're exposed to smoke, but are you exposed to smoke and heat at the same time? And this is especially key because in British Columbia and most parts of the world, wildfire season is during the warmest months of the year, and really high temperatures can actually help fuel wildfires. So there's those overlaying complex factors that people are often not just going to be exposed to smoke, but they're going to be exposed to smoke and heat. And this is going to have likely some important consequences for people's respiratory health. And then another really key area of emerging evidence is focusing on long-term exposure. So as I mentioned, most of the research to date into wildfire smoke has focused on short-term exposure and acute health outcomes, right? And this is because historically it was really this kind of sporadic occasional exposure. We were occasionally exposed to smoke and then it went away. And then, 1 or 2 summers later, we'd be exposed again and then it went away. So we didn't feel the need to look at it as a long-term exposure because it was just this really sporadic thing. But as wildfire smoke has become a more constant exposure, and certain communities, such as those living in interior British Columbia, are exposed to wildfire smoke summer after summer after summer, right? It's no longer this short-term occasional exposure. It really is this long-term cumulative exposure that people are having every single year. So there's been a shift in interest to focus on the long-term effects of wildfire smoke exposure. And to kind of set the stage of where this research is, it's very early. There's still a lot we're learning about this, but when we look at the long-term impacts of wildfire smoke exposure and the impacts on human health, right, it's starting to show that it doesn't just increase the risk of a hospitalization the next day, but it can also have longer-term health implications. And this includes things like looking at reduced lung function, looking at cancer incidence, looking at general poorer health status, right? So this review I'm highlighting here didn't just focus on lung health, but it's kind of setting the lay of the land of what we're currently learning about those more chronic effects of smoke exposure. And some of the key results that I want to highlight that we know is, I think one really important line of evidence is coming out about prenatal exposure. So when people are exposed in utero, what does that mean for their health throughout childhood? And this is some work from Dr. Sarah Henderson and her team at BC-CDC, and it looked at prenatal exposure to wildfire-related particulate matter and the risk of respiratory infections in your first year of life. And what they found is that there's certain periods during prenatal exposure, specifically the second trimester, that really carry an increased risk of having a respiratory infection in your first year of life. So it's not just that exposure in utero increases the risk of adverse birth outcomes, but it can also increase the risk of poor lung health really early in childhood. And I think that's a really key thing to understand when we think about who's at risk and who we need to ideally focus on for reducing exposure to wildfire smoke, right? Pregnant people and young children are a really key population. There's also some really good evidence coming out about the effects on lung function. So again, not just, are you going to go to the hospital the next day? Are you going to go to the physician about, some lung issues, right? Year to year, are you going to have reduced lung function? And there's early evidence that wildfire smoke exposure does have sustained effects on lung function. And this study I'm highlighting here specifically looked at a fire in Montana in the United States. And basically what this plot is showing here is it has FVC, right, which is measures of lung function. And the fire was in 2017. And these hollow shapes, the circle and the triangle here, is what they would have predicted the lung function to be between 2017, the following year, and then the following year. And these filled in ones down here are what they actually were, right? And what this shows is that there's really these notable decreases in lung function, and it sustains up to 2 years after the year that the fire occurred. So we are seeing these sustained effects on lung function when communities are exposed to wildfire smoke. And then another important paper I want to highlight came out of some researchers in Canada, specifically at McGill, and it looked at long-term exposure to wildfires. So not specifically wildfire smoke, but looking at long-term exposure to wildfires and cancer incidents in Canada. And what this showed is that people who were exposed to wildfires within 20 kilometers or 50 kilometers of their residence in the past 3 to 10 years had an elevated risk of lung cancer, right? And that shows that if you're really exposed to a decade or 5 years of prolonged wildfire exposure, that's going to increase the risk of these really chronic outcomes like lung cancer. And again, this is specifically looking at wildfires, not wildfire smoke, but I think it's a good indication of where some of the research focusing on lung health and respiratory health in terms of long-term exposure to smoke is moving. But with that, I think it's really key to mention that there's still a lot we don't know. So we're really confident about how short-term exposure affects our acute respiratory health. We're learning more and more about how it may be more toxic, how co-exposure to other hazardous exposures may play a role, and what the long-term implications may be. But there's still a lot we need to learn. And I think one of the key questions is focusing on that long-term exposure and whether it increases the risk of developing chronic lung diseases, right? So there's that early evidence looking at wildfires and lung cancer, but also thinking about, does wildfire smoke exposure over a long period of time increase the risk of things like developing asthma or developing COPD in addition to lung cancer. And one of the ways we're addressing that unanswered question in British Columbia is through a project called Lungs and Fire. And this is actually led by Chris Carlsten, and I'm lucky to be one of the co-investigators on this project. It's a brilliant team of people looking at this question. But the goal of Lungs on Fire, it's a 5-year project that's going to be looking at whether chronic exposure to wildfire smoke increases the risk of developing asthma, lung cancer, and COPD. And it's looking at it from multiple different mechanisms, right? Looking at specifically the mechanisms, if there's difference in risk by sex, gender, and age, how the role of exercise and diet, right, and the role of social and community level characteristics. So it's really this really integrated approach to try and understand in Canada how that chronic exposure to wildfire smoke is increasing our risk of developing chronic lung diseases. And I think this is a really important step towards trying to better understand the long-term health implications, especially in chronically exposed communities, like those living in the interior of BC or other communities that really just have exposure year after year after year. I think another critical unanswered question that needs to be addressed is focusing more on pregnancy and early life and childhood health. So how does wildfire smoke exposure throughout early life affect childhood respiratory health? And the project I highlighted by Sarah Henderson looking at prenatal exposure and respiratory infections by age 1 year, I think sets the stage really well for this. And to kind of further dive into those questions of how from preconception through early childhood, how your smoke exposure affects your lung health. I'm leading a project with Sarah Henderson looking at early life exposures to wildfire smoke and respiratory outcomes during childhood. And what this project is looking at is it's looking at a really long period of time. So not just prenatal exposure, but prenatal and postnatal exposure throughout early childhood, right? This top graph here is showing the periods of time that we're looking at, right? From, in utero all the way to, when you're 1 to 2 years old, from 2 to 8 years old, right? Different periods of life, and trying to understand how both your short-term and long-term exposure during those important periods of early life affect the risk of both acute and chronic respiratory outcomes. And this is really critical because, again, pregnant people and children are one of our most at-risk populations. So making sure we understand if there's certain periods of early life that carry a heightened risk, or if there's certain outcomes that are really elevated, right? Is it developing the risk of asthma in general? Is it just, more medication use, more respiratory infections? Really better understanding the roles of wildfire smoke throughout early life is really key for protecting children, especially with increasing exposure. And I think this will be really useful in terms of trying to inform questions around, when should we cancel recess at a school? Or should we have the soccer match tomorrow for, the kids' soccer match, right? Trying to think about how we really protect children while living in a world with increased smoke exposure is really key. And finally, another important question that I've been working on is thinking about those synergistic effects, right? Thinking about how extreme heat appears to amplify the effects of wildfire smoke on respiratory health. And focusing specifically on British Columbia is understanding, we know those communities that are exposed to both heat and smoke are facing increased risk, but understanding which communities in BC experience that co-exposure to heat and smoke and what's the nature of those communities. And this is really important for both protecting the lung health of those communities and also doing general climate change adaptation and mitigation planning, right? If we can figure out which communities face the most exposure, we can then better protect those communities, especially those people in the communities who have chronic lung conditions like COPD or asthma, right? Who are gonna really be affected by that dual effect of heat and smoke. And to look into this, I'm working with some of my colleagues at the BC CDC, looking at the co-occurrence of wildfire smoke and extreme heat across BC over a 13-year period. And, this is looking at both how often do heat and smoke occur, but also how often do they co-occur and how has this changed over time? And again, highlighting which communities across British Columbia are most vulnerable. And this, is kind of a key jumping off point to more thinking about the role of that co-exposure to smoke and heat in lung health and better protecting those who are more at risk of the respiratory effects of wildfire smoke. So understanding the most exposed communities to then inform how we can better protect those communities moving forward. And so that's kind of highlighting some of the research that we're doing in British Columbia to try and address those unanswered questions and move the research around wildfire smoke and lung health forward. I also kind of want to end on a note of how can we reduce the impacts of lung health. So I spent the last 30, 40 minutes talking about all the ways in which wildfire smoke affects our lungs, but I also want to highlight what we can do to reduce those impacts. And currently, we have a lot of good evidence that there's certain approaches we can take to reduce the impacts on lung health. And this includes focusing on indoor air quality, right? If people can shelter indoors, run an air cleaner, close their doors and windows, right? They're likely going to reduce their exposure to the outdoor smoke, right? And that's going to better protect their health if they're able to mitigate their exposure. A lot of work also focuses on local air quality. So if people are able to monitor their local air quality and check, that air quality health index and see how risky the health is outside or the air is outside, right? They can make informed decisions about, should I reschedule activity? Should I go outside? And this can also inform other individual actions, like should I wear a mask if I go outside or other things. So a lot of the focus right now is kind of focusing on individual actions of, check your local air quality, make informed decisions, run an air cleaner. And these are really good at reducing the impacts on lung health and other health outcomes, but they also have different levels of effectiveness, right? When we think about the ways we can reduce exposure to wildfire smoke and thus reduce the impacts on lung health, right? We have all these personal actions that have different levels of effectiveness, and they're also not, a one size fits all. Like it's not a silver bullet solution, right? If you run an air cleaner, it's not going to perfectly eliminate your exposure. If you wear a mask outside, it's not going to, be the right solution for everybody. And I think it's important to recognize that while we have these really useful tools for reducing exposure, there's limitations or concerns around each of them, and not one approach is going to be perfect. And so I think emphasizing these is key, but also recognizing the limitations around these different interventions is also very important. And as is work to kind of reduce these limitations or address these limitations to increase the accessibility of people's ability to mitigate their exposure to wildfire smoke. So in terms of, thinking forward and what we can continue to do to reduce the impacts of wildfire smoke on lung health, I think one critical thing is increasing the access, awareness, and usability of local air quality data and communications. So as I mentioned, checking your local air quality, checking your wildfire smoke forecasts is really key for making informed decisions. But people can only do this if they have air quality data that's local to them, right? So both increasing people's local access to air quality data so they can make that informed decision, right? And I'm highlighting a tool here called AQMap, and I think this is a really great resource. It combines air quality monitors from across Canada and lets people check what their air quality is, right? And so I think that's a really useful tool, but making sure we increase, the availability of that sort of monitor data so people can really make that locally informed decision around when they should, wear a mask, stay indoors, run an air cleaner. But I also think it's really key to focus on our communication around wildfire smoke. So this infographic to the right is some work from my colleagues at Legacy for Airway Health, and it was a survey in British Columbia looking at wildfire smoke communication and people's knowledge of it. And, highlighting here, right, 59% of the survey respondents, were about 750 people, 59% were not aware that you can get automatic air quality alerts via text or email. Right. So there's certain ways we communicate this important air quality information, but people aren't necessarily aware of how to access that information. And while in this survey, 67% of people felt like they knew what to do to reduce exposure, that still means that 33% didn't have a good sense of what to do to reduce their exposure to wildfire smoke. So I think focusing on both increasing the access of this data so it can be locally relevant to communities is key, but also making sure the communications really are, people can access them, they resonate with people, people know what actions to take, where to access this data is really, really key. I also think some other things that are really key is equipping communities with the tools and resources needed to mitigate exposure. As I mentioned, we often say, run an air cleaner or do this or do that. But for a lot of people, there's a lot of cost prohibitiveness around air cleaners. There's, a lot of information of what air cleaner should I buy, where should I go to buy an air cleaner? And I think making sure we're equipping all communities with the tools and resources they need to follow the advice we give to mitigate exposure is really critical. And two projects I want to highlight in British Columbia that are helping do this is First, the Breathe Project, which is focusing on running workshops across British Columbia to help communities build do-it-yourself air cleaners. And these are low cost, but equally effective solutions for improving indoor air quality. And it goes to communities across BC. It gives people the tools and supplies to build these DIY air cleaners, while also providing additional information about the health impacts of wildfire smoke and what people can do to mitigate exposure. So I think, community-led and community-engaged projects like this are really key because it helps remove that cost barrier or that knowledge barrier around improving indoor air quality. This other tool I'd like to highlight is something my colleague, Dr. Emily Brigham at Legacy for Airway Health has been working on, which is trying to help patients, especially those with chronic diseases and chronic lung diseases, make sure they know what to do during periods of smoke and heat. So working with their doctors and working with their physicians to make an action plan of, okay, they know where to check their air quality and temperature. They know what supplies they need to protect their lung health during wildfire smoke or extreme heat. So kind of making these tools and resources so people can better plan and prepare for smoke versus having to check, Twitter or other alerts. So I think these tools are really key for really equipping those communities with the tools and information they need. And finally, I think a really key thing in general is continuing to move forward to ensuring access to clean indoor air. One of the best ways we can mitigate exposure and reduce the lung health impacts of wildfire smoke is making sure people have access to clean indoor air. And the reason this is so key, right, I wanted to highlight this figure from the Vancouver Coastal Health Chief Medical Health Officer report, right? And it's showing the air quality during 2023 in August of two different indoor spaces in Vancouver. And what this shows is it compares, the blue line is outdoor air quality, the green line is indoor air quality, and the left is showing a cleaner airspace that has really good indoor air quality, right? So they have air filtration, they're likely closing their doors and windows, and you can see how significantly reduced the exposure to wildfire smoke is in that indoor environment. So it's really effective and it's working really well. But on the right here, we have a plot of another indoor space. And you can see that when, there's not good air filtration, if windows and doors aren't closed, if other actions aren't taken, right, the indoor air is going to be as bad as the outdoor air. So as long as we continue to communicate that in general, seeking clean indoor air or seeking indoor spaces is a good way to mitigate exposure, we also need to ensure that those indoor spaces are actually having that clean air and are actually safer than the outdoor environment. And I think some ways we can do this is recently Vancouver passed some laws that by 2025, all new multifamily buildings need to have air filtration included. And that guarantees that those people in those apartments are going to have clean indoor air, right? They don't have to run the air cleaner themselves, but their building is going to have clean indoor air. So making clean indoor air a given via policy, I think, is really key for reducing those impacts on lung health. And similarly, Health Canada has also put out a good guidance of how to make cleaner airspaces during wildfire smoke events. So really investing the time and resources to both change policy and have clear guidance of how to actually make indoor airspaces safe during wildfire smoke events is really, really key. And with that, I think I've covered a wide range of topics, and I'm happy to go into questions. And if you have a question, but you don't want to ask it or would like to follow up later, my email is also here, and I'm always happy to talk about wildfire smoke and lung health. And I'm happy to go into the conversation now.
Awesome. Yes, we will definitely do that. And for the audience, we have scheduled this to go past 11, so we don't have to feel so much of a rush, and hopefully can have that nice bona fide conversation. So don't be shy. One of the things I've been thinking about, that was wonderful, Stephanie. I learned a lot. In fact, took a few of the references down that I hadn't seen before, so you helped me. One of the themes throughout, especially as you built towards the end, is something I'm thinking a lot about in terms of wildfire smoke versus traditional, mostly traffic-related pollution, and the difference between guidelines and policies. So just bear with me, because I think this is really important. My impression, and I think you reinforced it, is that traditional traffic-related pollution lent itself better to actual policies than wildfire smoke, whereas wildfire smoke needs in quotes, lean more on guidelines than policies, with some exceptions. And you did give the exception of what Vancouver is doing in terms of requirements from buildings. But it seems like you're nodding, and it's the nature of the beast, I guess, because we can control car regulations, and we had air care, which was well before your time, etc. But could you comment on that, besides what your apparent agreement is, and how do we grapple with that? In the sense that it's a little bit daunting to face this through guidelines rather than policies, if you want to have a heavy hand for something that's so devastating based on all the data you showed.
Yeah, so I think that's a really great point to bring up. And it's one of the challenges with wildfire smoke is we can't regulate it the same way we regulate other sources of air pollution, right? With traffic, with industry, with factories, right? We can kind of put caps on how much you're allowed to emit. We can promote electric vehicles, right? We can do things and take actions to, at a policy level, reduce emissions. And I think the hard thing with wildfires is because, most of them are human caused, but they're kind of a little bit in the natural, or they're a little bit hard to contain. We can't tell the wildfires to reduce their emissions, right? And it's thinking about other ways we can do policy is different than traditional air pollution sources, I would say. The policy interventions can't be the same as what we've used historically to regulate air pollution. And I think it's both focusing, because a lot of it is, encouraging individual action, especially currently. That's one of the best tools we have is, individual response of, can you go inside? Can you wear a mask? Can you check your air quality? Right? Focusing on that smoke communication is really key of how do we communicate and access the public in a way that's actually going to encourage them to change their behavior, because we can't control the fact that there's wildfire smoke in the air right now, but we can, hopefully have people and encourage people to take action. And similarly, I think the other way the policy is different is, again, thinking about like building regulation of like the city of Vancouver did of, can we ensure clean indoor air, right? We can't maybe guarantee that wildfires are never going to happen and smoke is never going to happen, but we can at least at a policy level ensure access to clean indoor air. And then I think kind of moving a little bit out of my, public health and wildfire smoke space, I think there's also things to think about with policy and interventions around wildfire management, right? When we think about prescribed burning, when we think about forest management, right? There's things we can also do at that level to kind of reduce the likelihood of mega fires, right? Or fires like 2023, if we're able to do, and implement policy that changes how we do prescribed burning or how we manage our forests, then that can also kind of go upstream to the source of wildfires and try and mitigate it there. But it does look very different than the policy solutions when we think about air pollution from other sources.
Yeah, the prescribed burning topic is huge. And maybe we can get to that later, although neither one of us are true experts. Turning to the questions, several excellent questions, and I'll do my best to get through them. So one from Janelle. Janelle is essentially noting that different sources may give different information even simultaneously in terms of air quality. I've actually noticed more that they've been more similar than different, but Janelle's noticing differences. And one of the things I'm wondering is sometimes, first of all, there's AQI versus AQHI. There's different time averaging. So it might be averaging an hour, a day, etc. But maybe just comment for those concerned that they're getting heterogeneous information from different sites, what you'd advise.
Yeah, so I think that's a great question. I think one of my best guesses as to why you'd be getting different sources is potentially a lot of that data, right? When we look at what your local air quality is might be pulled from different monitoring networks. So if you're looking at, provincial or government, they're going to be looking at the government regulated monitors, right? And so that's going to be whatever your closest monitor is. And there's a potential that if you're looking at, I highlighted AQMAP as a resource, right? That has basically low-cost monitors, government-regulated monitors, and other kind of sources of monitor data, right? If your closest monitor, that's, one of the government-regulated ones, actually might be 5 kilometers away, right? That is going to report the air quality there, versus if you're looking at, AQMAP or something that's pulling data from a low-cost network like Purple Air, right? That might only be 1 kilometer away. And the challenging thing with wildfire smoke is because of smoke plumes, they can have relatively steep spatial gradients, or like kind of steep edges where, here you can have really bad smoke, and then 5 kilometers away, by nature of how the smoke plume moves, you can have better air quality. So I think one of the reasons there might be differences based on that is what monitor data they're pulling it from and how close is that monitor to the actual location you are. And to address that, I mean, I think checking multiple sources of air quality data is a really good tool, right? It's, the AQ map, one of the reasons I like that and recommend that is because it collects multiple sources of data. So you can kind of really see different monitors and what your local air quality is, and it kind of gets you a better sense of what the local air quality is. But I think the differences might be a source of the monitor data they're pulling from. And as Chris mentioned, might also be, are they averaging 1 hour? Are they averaging 4 hour, right? How are they kind of handling that data? But I think one of the best ways to address that is to kind of look at multiple sources of data, and kind of try and get as local as you can, right? The more local and the more close to either your soccer field or your residence you can get, right, the more accurate that data is going to be.
Yeah, I think thanks. That might help anonymous also, because the answer of where the PM data is coming from is basically what we just said. It's not coming from one place. I want to turn to Patricia's comment I found really compelling. And it's a complex issue, but Patricia's basically, I think one of the sort of foundational pieces of what Patricia is talking about is how we always say that people with pre-existing lung disease are most at risk, and you heard Dr. Cleland say that, and that's generally true. But another point that Dr. Cleland mentioned is that we don't know that much about the chronic effects, and I'll let her speak, but I just want to say to Patricia, one of the issues and one of the reasons we're focusing on chronic effects in the Lungs on Fire grant and beyond is that it really affects everyone. And so it's not people with just pre-existing lung disease. In fact, it's the healthy people who in some ways have the most to lose by the very nature of starting in a healthy place. So I'm really sorry that you're getting stigmatized in your own words. It's unacceptable. And one of the messages we have to get out there is that no one is really immune to this. So we are all in it together. And maybe Dr. Cleland has more to say about it.
Yeah, I mean, I think Chris said it very well. I think I echo his sentiments that it's, you shouldn't be getting stigmatized. And I think you're right that, I think at the end of your question, you say better messaging to help educate the public. And I totally agree. I do think our communication and our public health, the way we communicate the risks of wildfire smoke, does need to be continually updated and adapted, especially as we learn more about the chronic health effects, and we learn more about the different ways it impacts us. And I think, wildfire smoke poses a risk to everybody, right? There's, again, certain people who are more at risk, but nobody is perfectly immune to wildfire smoke. And trying to, educate the community about that and get that message across, while also striking the balance of, we need to learn how to live with wildfire smoke and live in a society that has increased smoke exposure. But I think addressing the stigma is really key, and making sure that everyone understands the risk it poses both to them and to other people is really key. So it's not like, oh, it's only affecting these people. It's like, no, it is affecting everybody, and here's the different ways in which it affects everybody. And I do agree with Chris that understanding better about the long-term effects of, maybe you're young and healthy, but if you're exposed to smoke every single summer for 5 to 10 years, that actually might have some implications for your health, right? And kind of getting that information and being able to communicate that information, I think, is going to be really key to help reduce the stigma around it. And again, I think improving our messaging and improving our public health communication around the health risks of wildfire smoke is really, really important.
Yeah, there's so much work to do there. And I think Patricia and her other comment touches on, it's sort of the flip side, or the way I'm paraphrasing it, that there are some that, depending on the jurisdiction, will be more prone to shutting down events than others. And the reason I say the flip side is because if we tend to shut down events, depending on the threshold, if we tend to shut them down sort of conservatively, meaning, modest amounts of smoke lead to widespread shutdown of various events, it causes its own problems, and people get upset in their own way about, things being canceled where it depends on your point of view, but maybe sometimes canceled too easily. The point I want to make about this before turning to Stephanie is that we're undertaking a project just to understand exactly this issue of what are people's actual priorities, because with all respect for Patricia, there are other people that say, you know what, I don't want all these events canceled. I understand that this is a problem with smoke, but I also want to be outside exercising, or want my kid to be outside exercising, or can't get childcare. And so without passing judgment on any particular viewpoint, I don't think we really understand the public's true priority list, which is kind of the public that we serve ultimately. So yeah, Dr. Cleland, how do you think about balancing the fact that the smoke causes problems, but then again, life has to go on in some ways?
Yeah, I think it's a hard question, right? I do think the balance is key because it's the balance between, I often get questions during smoke season of like, should I go outside for a run? Should I exercise? Like exercising is really good for my mental health, but I don't want to put my physical health at risk. And I think when we think about, child development and child health and mental health, right? There are certain things that, exercising and like, team sports and other things that are really good for us in other ways. And then trying to figure out how to balance that with the risk that is posed by wildfire smoke is critical. And I don't think we have the exact answer right now of what the correct balance between those things are, but I think trying to get a sense of how to balance it is key, especially when we think about communities that have that chronic exposure to smoke, right? If you look at some communities in the interior of British Columbia, right, they have such severe smoke every single summer. And does that mean summer should be canceled, right? Should no one ever go outside, right? That's really harmful in other ways for people's developmental health. But we also want to make sure we're protecting that community's long-term health and their lungs and their general development. So I think, I don't have the answer, but I do think moving research towards trying to understand what that balance looks like and how do we protect the communities while also, still encouraging child development and exercise and other things that are important for other aspects of our health is really key. So maybe not the most satisfying answer, but I do think it's a really complex thing. And, it's the broader umbrella of like learning to live with smoke, of how do we, given the health risks of smoke and given increasing exposure to smoke, how do we enter a world in which smoke is a part of our summers and a part of our lives while also continuing to do other things like outdoor sports or exercise or other important things that are really critical to our day-to-day lives.
Yeah, and if anyone answers that question in the future simplistically, I think one thing we can say is they're not giving it its due, because as you've heard, it is very, very complex. The questions are pouring in, which is fantastic. I'm going to do my best to choose wisely, and knowing that we won't be able to get to them all, and Dr. Cleland's already opened herself up to the follow-up questions offline. Maybe there's an educational mission to be done in response to Richard Gould from 10:57 a.m. because some people don't understand the AQHI, and it is a combination of PM, nitrogen dioxide, and ozone. And so those are really the three sources that go into the AQHI. Can you see that question, Dr. Cleland? And do you think I addressed it? Is the AQHI level
clean air shelters?
No, is the AQHI, it's the next one from him. Is the AQHI level current or forecast based on only AQ monitoring? I mean, it is based on 3 AQ indicators, so I guess the answer is yes.
Yeah, so the current AQHI, if you look at if you go and look at BC's current AQHI, that is based on air quality monitor data, right? The available current air quality monitor data. And during periods of smoke, there's actually 2 different ways we can calculate the AQHI. So I think as Chris alluded to, a lot of the time it's calculated based on the concentrations of 3 pollutants. So fine particulate matter, ozone, and nitrogen dioxide. I think that's correct. And it's those 3, but during periods of smoke, it often is based on PM 2.5 alone. So depending on basically they calculate 2 AQHI values, one using those 3 pollutants and one just using PM 2.5, and they report whichever value is higher. So during periods of smoke, because of how extreme particulate matter gets during those periods, the AQHI is going to be based on particulate matter readings from nearby monitors.
That's a really good point. I forgot about that
Forecasting,
caveat. Yeah, the
and the
caveat of the
forecasting is
high.
going to
Yeah.
be based on other sources of data because we can't necessarily use monitor data. So the forecasting is a much more complex of integrating a lot of other information to kind of forecast where the smoke is going to be going and what the air quality might be in the next 72 hours.
And that'll help answer a couple. There was a question earlier, I can't find it, but I know it was there about how we know about smoke days versus non. And again, I'll let Dr. Cleland elaborate, but there are a couple of things. There's one thing called the Can Awesome, or Can Awesome is kind of where that was designed, but it's OSSEM model. That's a fairly complex model that might not be easy for the lay audience, but there's also a way that sometimes we think about it where if the PM level, PM 2.5 is above 100, you can virtually guarantee that it's smoke affected, because it's almost unheard of for traffic pollution in our region to get that high. Yeah, for those that want to know, Dr. Cleland, about whether on a given day, how much, I guess, or to what extent it's smoke affected versus not, are there better resources?
Yeah, I mean, we can use, so in terms of kind of current, if you want to know currently if is wildfire smoke affected or not, right? You can use, as Chris mentioned, you can use that data on, is it really high levels? Because generally in British Columbia and in Canada, we're not going to see extreme particulate matter levels from other sources, right? It's most likely going to be wildfire smoke, especially if you're working between, June through September, right? We kind of know the period of smoke exposure. In terms of kind of the forecasting, in terms of also historical data, right? How do we know historically if it was a smoke impacted day or not? We use monitor data in addition to other sources of data like satellite data. So satellite data is actually a really great tool for understanding whether something is from smoke or not, because we can use that satellite information to look at where the smoke plumes were. And we can basically say, where were the smoke plumes and what was the PM 2.5 in areas that were covered by a smoke plume. And that can help us kind of tease out whether something was a smoke impacted, day versus a non-smoke impacted day. And we can also, if we're looking historically, often integrate information from air quality modeling. So we have things like chemical transport models or other data sources that pull in a lot of information in addition to the air quality, like, integrates things like air pollution physics and chemistry. It can control for different sources of air pollution. So is it coming from traffic? Is it coming from wildfires? And using that sort of complex modeling, we can also get at, whether something was a smoke impacted, day or a smoke impacted particulate matter concentration versus not. So there is different sources we can use, but I would really highlight satellite data as a really key thing to have in addition to air quality monitoring to really understand whether something is a smoke impacted day or not.
Yeah, so I guess kind of embedded in that is a bottom line question from Amen Adibi about how you would characterize the quality of the forecasts, short-term forecasts that are provided like firesmoke.ca. Yeah, and I don't know if we answer that through like R squared type things, which are kind of complex, or just a more general characterization of the quality of the forecast. I mean, I guess they're being tested for what actually happens versus what was predicted.
Yeah, so in terms of the quality, I think I would say that we're not perfect at forecasting wildfire smoke yet, just because it's a complicated thing to forecast, right? There's so many things that play with wildfire smoke, of the wind, the temperature, right? That kind of help dictate where the smoke moves. But I would say the forecasts are getting better and better. So, fire smoke, which is one of the forecasts, I wouldn't say, is the perfect, it's going to perfectly always predict it. Like, similar to weather, right? If you look at the weather forecast, it might say it's going to rain in the afternoon and then it never rains, right? So I would say, look at the smoke forecasts. They're relatively reliable, and scientists and researchers are working to improve them all the time, right? So they're going to become increasingly more reliable with the resources that are being put behind them, but also recognize that they're not always going to be the perfect estimate, in the same way that the weather's not always the perfect estimate of what's going to be happening in the next 72 hours.
Yeah, and I think in response to your 11:00 a.m. AQHI potentially downplaying risk of PM 2.5. That's been a longstanding concern, but I think in part what Dr. Cleland said about when PM 2.5 is particularly dominant, it's increased in its emphasis, as she described before. I think that's somewhat in response to that. But a nuanced question that you asked. I want to get to RML though from 10:58 a.m. because I think it's a particularly important question that we're grappling with in Lungs on Fire and beyond, in terms of just paraphrasing more broadly, what does the public see in terms of the research, and how are they reacting and changing their activities at all? And we started dipping our toe in that in some work that Dr. Cleland mentioned, but more in terms of how are they actually hearing the data, from what sources, are they aware of the different options for getting the data, as to what they actually do with it. That is kind of the next level. And I don't know, there is some recent work by Kathy Slavic in terms of how they respond to different ways it's presented, like the AQHI in different formats, and how parents may respond to that, but not much. And I don't know if you know more about this in your wanderings through conferences and stuff, if there's anything hot, Dr. Cleland, about people's response to these data.
Yeah, I mean, I think it's a really critical question because, the work that we're doing is trying to hopefully, both better understand the health impacts of wildfire smoke, but also encourage people to make informed decisions around their exposure and their health. But I think those are kind of, I'm very much on the kind of exposure assessment epidemiology end, which looks at those health impacts. And there's a whole nother field around health communication. And I think that's really key. In order for the epidemiologic research to sway public opinion, we need good communication, and we need to make sure that communication is accessible, is usable, is relevant. And I think there has been more and more research looking at how we do wildfire smoke communication and whether people actually change their behavior in response to it. And as Chris mentioned, Kathy Slavic, who's currently based at the University of Oregon, is doing a lot of good work into using survey responses of like, do you know where to check your air quality? Do you change your behavior? How do you kind of use these different tools? And I think that sort of research is really necessary in tandem with the research looking into, the long-term health impacts and other factors, right? So we can make sure when we get the new evidence, it's actually communicated and tailored in a way that resonates with people. Because I think currently right now we use a lot of different tools, but we don't actually have a great sense of how effective they are in promoting behavior change and health behavior change. So I would say, we don't know, I wouldn't say I know that my research has swayed the public, but, trying to both research it in a way that's relevant and then work with people who do health communication and knowledge translation to make sure it's communicated and, accessible in a way that actually can promote health behavior is a really key thing. And I think a lot of researchers working on wildfire smoke and lung health are aiming towards.
Yeah, I totally agree. Couple things. We still have a few minutes, but I just want to try to cover as much ground. For the most recent comment from Bajosi, I do want to emphasize that I think there is a problem that we're not addressing occupational exposures nearly enough, and we're working with BC Wildfire Service and others to try to overcome that. We've got a few grants in, but a long, long way to go. And wildland fires in particular are typically exposed with no mask whatsoever. So there's some really atrocious challenges there. So thanks for highlighting that. I want to turn back to Richard Gould. His question is important, but also allows me to reflect on some of the data you showed. I'm resisting very kind of minute, detailed things, but because Richard was highlighting how the data from Sarah Henderson and others is highlighting, in utero, etc. And of course, yes, that will lead to chronic lung impacts if those changes persist. I wanted to ask you, I didn't read the paper, but is there a hypothesis as to why second trimester is the greatest risk, where, if I recall correctly, the first trimester was actually protective, at least for one of the endpoints. The organ development is greatest, as many of you know, in the first trimester. So that was kind of a bit odd, and I wonder what the hypothesis is there.
Yeah, so I think that's a great question. And I think there's some hypothesis around it, but I think the real answer is we need more research, right? I think it's kind of the slightly unsatisfying but important answer of we're seeing these windows of heightened susceptibility, and from an epidemiologic standpoint, right, we can hypothesize as to why, but we also need the research from additional fields, right? People doing more lab-based studies to also think about the mechanisms, right? So I think it's like that in tandem research with, I think, Lungs on Fire, the project we're both working on, is kind of looking at mechanistic impacts as well as epidemiologic population level impacts, right? And I think, windows of susceptibility, especially during pregnancy and early childhood, are really key to better understand. And you're right that the second trimester was one that had an elevated exposure. And since that was one of the first studies to be looking at respiratory outcomes and, prenatal exposure, having additional research to kind of dig into that a little bit further and understand those windows of susceptibility is really critical. And that's, one of the things that the project Sarah Henderson and I are co-leading is going to try to dig into more, right? Is kind of get more at that question is what's going on in the second trimester? Is there certain periods in the second trimester, and tying that with the existing evidence of biological mechanisms as to why it's not the first trimester and it is the second trimester. So I think there are likely, early evidence shows that there's definitely windows of heightened susceptibility, both in utero and in early childhood. But, digging more into that and trying to get more a bulk of evidence so we can confidently say that, the second trimester versus this trimester versus infancy, right, are really the key periods. And that sort of evidence is going to be really critical of protecting both pregnant people, but also when you think about daycares and, elementary schools and other programs that serve those really young children, right? If there's periods of heightened susceptibility, it's really key for them to understand that to better protect those populations.
Yeah. And also related to Lungs on Fire, some of these things just naturally do link to it. So hopefully it doesn't seem so much self-promotion of our project. But I'm going to try to say Jing Xuan Zhao noted that it's something that you alluded to earlier. A lot of our attention is on the high AQHI days, and we're concerned about the dose response curve that you showed from Sarah's paper, which is steep at the lower concentrations, and all of the chronic implications. So first, I would just say in response to that what I just said is we're studying that in Lungs on Fire, and in particular, we're looking at, for example, if people are exposed to multiple moderate exposure days versus a single high exposure day, we're able to model that both experimentally and epidemiologically. So we're looking at that very quantitatively to answer these questions. But I think it also ties into the communication that we keep talking about repeatedly. There's a big concern that people go by what's visible. And again, Dr. Cleland mentioned in regards to the graph of the steep dose response curve from Sarah Henderson, people respond to what's visual. And if they don't see it, that is smoke, then they think it's safe. And so I guess I'm just repeating things to tie things together, but you're welcome to comment, Dr. Cleland. I think we have more education to do about that.
Yeah, I think I definitely agree in terms of like the low levels versus, the exposure patterns, right? Exposure levels, exposure durations, exposure patterns. And I think, we have early evidence that there's a lot of health burden happening at those lower exposures, and that doesn't necessarily align with how the AQHI communicates the risk. And I do think that, falls a little bit into the health communication category, right? When we're thinking about how do we communicate that to communities of, is there ways we can communicate that without, we don't want to go into the realm of inciting a ton of fear, right? Again, it's that balance question, right? How do we communicate the risks while also not being so fearful about the risks, but knowing that low concentrations when you can't smell or see it pose a risk is really, really critical. And I also think, as Chris mentioned, doing research to better understand of, there's a lot of burden happening at the lowest concentrations, but when we think about how wildfire smoke exposure happens, right, it doesn't happen evenly over a year, right? There's different spikes and different levels throughout different periods. And again, does it really matter if you're exposed to one really severe smoke event, or does it matter more that you're exposed to a lot of really mild smoke events, right? And I think we don't know the answer to that question right now, but I think getting that answer will also help us tailor that health communication around what levels really pose the greatest risk, and should you be really concerned when it's mild, or, does it actually, the focus really should lie on the high concentrations once we dig into the nature of the lung impacts of, different exposure durations and patterns and levels.
I wonder if that relates to prescribed burns, and we said that we might try to get back to this, although we both revealed that it's not the true focus of our expertise. But just because Annie, who we know well from Legacy for Airway Health, mentioned this, the one of the things I'm, it's not new, but I'm seeing more and more is attention to prescribed burns being done in a way that's very targeted and very careful to minimize exposures. So the reason I said maybe it's linked is because one can argue that those are very high exposures when you do a prescribed burn, and to the extent that the highest exposures are the quote unquote worst, which we know is not quite correct based on everything we're saying. I can understand the alarm, but do you agree, Dr. Cleland, that the experts in prescribed burns are very well aware of this and are doing everything they can to mitigate that risk by doing them in a very thoughtful way, and that the alternative is potentially worse?
Yeah, I think that, prescribed burning is an important and critical tool for fire management. And I think one of the benefits of prescribed burning, from what we understand about the health impacts of smoke, is shorter, lower level smoke exposures might not be as bad as, extreme smoke exposure levels, so like something like the 2023 fires, right? And I think the questions with prescribed burning is the people who do it are very skilled, and they often have it very controlled, and it is going to be, the benefit is in terms of when we think about health impacts and the toxicity of what's in smoke, right? With prescribed burning, that's just going to be forest burning, not homes and the appliances and the electronics and the things in homes burning, right? So what's burning will still not be good for our health, but it won't be including those additional toxic chemicals and other sources. And additionally, it's going to be at a much lower level, and it's going to last likely less time, and it's going to travel less far, right? So especially when you think about British Columbia and Alberta and a lot of our provinces in Canada, a lot of them are very rural and remote and forested. So in terms of prescribed burning, if those are done well and those are done in areas that aren't densely populated with lots of communities, right, we can, likely reduce exposure because we're burning in an area where that smoke isn't going to really reach populated regions. And then I think the critical thing, though, when we think about prescribed burning with smoke exposure is, well, we don't really know if those low-level frequent exposures are better or worse compared to like a really extreme exposure due to a mega wildfire. We do know that mega wildfires are bad, right? And preventing those is important. And I think a key thing when we move, if we start moving towards more and more prescribed burning, is working with rural and remote communities to make sure they're equipped to prepare for what might be, increased frequency of mild exposures, right? If we're thinking about those really rural and remote communities who live near and in forested areas where prescribed burning could be happening, making sure you're working directly with those communities to make sure they know when prescribed burning is going to be happening, they can adequately prepare, they have access to the tools and resources and information to mitigate their exposure when that prescribed burning is happening, is going to be critical. So I think it's an important tool if done in tandem with, the communities that are likely going to experience more frequent mild exposures by nature of prescribed burning.
I agree. I'm going to try to squeeze one more thing in because it's substantial and I think worth a comment. So Anonymous at 1055 talked about the difference between the composition essentially of aged, so the aerosol from fires that's been transported over days to weeks sometimes, even across the continent or multiple continents, as you saw from Dr. Cleland, versus the local. I think it's an area that's really got a big gap, but we do know that it's got more oxidation over time. But I'll put the question as the direct question of the evidence. I haven't seen much in terms of well-designed study that can really say head to head, because it's all kind of speculative when you, like, say, for example, look at New York in that exposure from 2023 versus BC, because they're different people and different healthcare systems, blah, blah, blah. Anything more you can say? Is there anything firm about that or getting there?
Yeah. I would say, I mean, I think it's a very important question, right? Because fresh versus aged smoke is not the same, right? By nature of the process, processes that happen as smoke is in the air and it transports over longer distances. I've seen some early evidence that I think it's aged smoke might be slightly more dangerous to health than fresh smoke by nature of, what components are in it by the time it ages and transports further away. But I would say that's, I haven't seen extensive evidence, and I wouldn't confidently say that, yes, aged smoke is objectively worse for our health than fresh smoke. So I've seen there's some research that's looked into it, but I think we do need more research looking into the differences versus fresh versus aged smoke. Because when we think about long range transport in the communities that are exposed to different smoke, right, it's not just what's burning, right? Their composition and toxicity might change if it's the type of tree that's burning or whether its house is burning, but it also might change depending on how far you are from the fires by nature of the aging of that smoke. So I think there is early evidence that there is a difference in how dangerous it is to our health, but I wouldn't say there's enough evidence to, confidently conclude which type of smoke or how that different type of fresh versus aged impacts our health.
Yeah, more work needs to be done. I mean, the New York thing was interesting because there was a group led by, well, not even a group, really an individual, mostly George Thurston, who really pushed back on how that smoke from 2023 into New York had an impact. He was arguing actually against it having a significant impact, and he's actually a proponent of industrial sources being much more toxic than long range wildfire smoke plume. And I think I can confidently characterize his views that way. So it is a controversial thing for ongoing research. I think I'm in the position now appropriately to close and thank Dr. Cleland, thank BC Lung for hosting this. We had close to 200 individuals. We had dozens of comments. As always, these BC Lung sponsored events are well attended. So thank you for organizing them in that manner. And this will certainly be an ongoing discussion, you can tell. So stay tuned for future events. And I thank everyone, especially Dr. Cleland, for the presentation and for your attention. Have a great day, everybody.